Go and let's take a look at some of our data slides. Our key indicators, you'll see on the key indicators, cases down. We're looking at this number. Love to see it go below 1,000. That's the 21-day average per day. So we're trending certainly in the right direction. Eric, the next one. This is the number we continue to look at. If you recall, some time ago, we said 50 cases per 100,000 for a 2-week period statewide was where we wanted to get to. We have seen a continuous decrease. We're now going down about 2 a day, to somewhere between 1.5 to 3 a day. We're going down. We're at 89. So as you can see, we've got about 39.8%, almost 40%, or 40 to go, or cases, excuse me, not percent, but cases to go. So we're moving in the right direction in regard to that. Eric, this is hospitalizations. Our hospitalizations, last reported number of Ohioans in the hospital for COVID is 767. 767. So that is obviously a number that's been coming down. We're very happy about that as well. Any other numbers there, Eric? Okay. As we continue to look at the numbers of vaccinations being administered across Ohio, we know that Ohio Medicaid beneficiaries have a lower uptake than their fellow citizens in Ohio, and it's appreciable difference, 42% compared to about 45%. So, excuse me, 22% compared to approximately 45%. So 22% Medicaid, that obviously is not a number that we're happy with. It's much, much too low. And earlier this month, we challenged our managed care plans to do much more in this area. Our managed care plans are those who are delivering, seeing that the services are delivered in regard to medical care. We must get these numbers up. They're simply unacceptable. The managed care companies are now implementing a game plan to do just that. And these are some of the things that they are doing. Partnering directly with pharmacies, they're providing incentives such as gift cards to people on Medicaid who get vaccines in pharmacies. They're incentivizing pharmacists to counsel people picking up prescriptions about their vaccinations. That latter point is very, very important. Having the pharmacists spend time with that individual and talking and counseling them in regard to the vaccinations. Next, working with local health departments, community providers, faith-based efforts to help get the word out about vaccination events to people on Medicaid. Where is the vaccination occurring? Where are these events taking place? Managed care is also providing staff to help run the events when needed and providing transportation to make sure people can get to and from the vaccination locations. Finally, tailoring strategies to meet people where they are. Certainly something that we've been trying to do throughout this. This is a special effort in regard to people who are on Medicaid. They've identified individuals, the managed care has identified individuals who can't leave their homes and are working with providers who can go directly to them with shots. They're also working with providers to help them create vaccine opportunities outside of normal business hours. These major efforts show promise, we believe. We're hopeful that this will bring about an increase in vaccinations among those people who are on Medicaid. So a high priority, something that we have challenged the managed care companies to do. Again, getting people vaccinated is how we get out of this pandemic.